Antimicrobial resistance is a potential pandemic of the future. It is silent and slow moving and can have a devastating impact on all of us. To address this public health issue requires a collaborative, multi-sectoral, and transdisciplinary approach. The One Health approach, working at the local, regional, national, and global levels. The engagement of sectors outside human health, such as animal health, food, agriculture, and environment, had been a challenge that is slowly being addressed through the One Health collaborations on AMR. WHO India has been engaging with all partners, including the India offices of FAO and UNEP, for addressing the complex, multifactorial public health challenge due to many issues: misuse, overuse, irrational and irresponsible self-medication, over-the-counter sale of antimicrobials, among others. India has a national action plan on antimicrobial resistance, as well as a Delhi Declaration on Antimicrobial Resistance, which were endorsed at the Inter-Ministerial Consultation on Antimicrobial Resistance in April 2017. Health being a state subject, the focus of action should be to develop state action plans for containment of antimicrobial resistance, or SAPCAR, in all states and union territories of India. WHO India supported the Ministry of Health and Family Welfare in the development and implementation of SAPCAR in Kerala, Madhya Pradesh, and Delhi. Using the experience from these states, we are working to engage other states and union territories to develop their state action plans on AMR. WHO India has supported the Ministry of Health and Family Welfare in establishment of governance mechanisms on AMR, the Intersectoral Coordination Committee, Technical Advisory Group, and the Core Working Group on AMR. In addition to the development of the National Action Plan on AMR, the Delhi Declaration, SAPCAR in 3 states, we also convened the first regional workshop on developing SAPCAR for the South region early this year, in collaboration with the Ministry of Health and Family Welfare and the state government of Kerala. Surveillance of AMR is a critical priority for benchmarking the status of AMR, monitoring the impact of interventions, and in prioritizing effective evidence-based actions. WHO India has helped to establish 3 state-level AMR surveillance networks in Maharashtra, Kerala, and Delhi. And more state networks are planned in the future. We are also supporting a One Health AMR pilot project in Krishna district in Andhra Pradesh, in collaboration with the Ministry of Health and Family Welfare, the state government, and the Netherlands government. The challenges include changing and competing health and development priorities, such as that in the context of COVID-19, where all resources have been moved for that response. Engagement and ownership of One Health AMR stakeholders, investing in AMR activities within government budgets, and also making those investments sustainable, strengthening the implementation of existing policies and regulations, as well as monitoring and evaluation. The lack of dedicated human resources and systems to address the AMR agenda and awareness and advocacy through strong community engagement is the need of the hour. We must look at the entire spectrum and work towards devising and implementing tailored strategies based on evidence. India's National Action Plan on AMR is well aligned with WHO's Global Action Plan on AMR. WHO support is aligned to the strategic priorities of the GAP, or the Global Action Plan on AMR, and the NAP, National Action Plan on AMR. India is enrolled in the WHO's Global Antimicrobial Resistance Surveillance System, or GLAS, and has been contributing AMR data from NCDC, ICMR, and the gonococcal AMR surveillance program networks. We also have WHO tools and guidelines. One is the WHO Net software developed by a WHO collaborating center for AMR surveillance that has been adopted by NCDC's AMR surveillance network and the 3 state surveillance networks I mentioned. The WHO Laboratory Assessment Tool for National AMR Reference Labs has been adapted in the Indian context and used for assessment of 3 state surveillance networks. The antimicrobial consumption tool, developed by another WHO collaborating center in AMR, is being used in NCDC's National Antimicrobial Consumption Network. WHO's global guidelines for infection prevention and control were the basis for the adoption of the Indian context in the National Guidelines for Infection Prevention and Control in Healthcare Facilities. The Access Watch Reserve or AWARE classification of antimicrobials is being included in the latest revision of the National Essential Medicines List. WHO's Global Pathogen Priority List of antibiotic-resistant bacteria is being adapted as India's Pathogen Priority List, IPPL, from India's perspective to incentivize research and development of newer antimicrobials, diagnostics, and alternatives. The One Health aspects of AMR containment, surveillance of antimicrobial use in all sectors, and engagement of other sectors, especially the environmental dimension of AMR, could be areas where India may be able to learn from other countries. Another area is budgeting and costing national and state action plans on AMR and estimating the national burden and impact of AMR. However, there are many things that other countries can learn from India. For example, India's approach to implement AMR containment at the subnational level. Through state action plans for containment of AMR, this is a very good example of how other big countries with a federal structure can work towards AMR containment. Although it is not solely the responsibility of WHO in our role to convene and catalyze partners, we have been somewhat successful in the NAP AMR and the Delhi Declaration on AMR, which was endorsed by 4 union ministers in the presence of senior officials from 12 ministries and multiple departments. We continue to work closely with the Ministry of Health and Family Welfare in engaging the other ministries and departments. The ESBL E. coli tricycle project on AMR was adapted for India and built on the experience of a previous project on AMR in the Kolkata wetlands, which shall help initiate integrated surveillance of AMR in human health, food, animals, and the environment, the One Health approach. We are also well engaged with many other organizations at national and subnational level for an effective One Health containment of AMR. These include government organizations and entities, professional associations, civil society organizations, medical colleges, and UN and other health partners. Going forward, the activities for containment of AMR under the National Action Plan on AMR needs to be reviewed regularly and updated. And the rollout in the states and scaling up that action in all states and union territories is key for us to move into this agenda in the future.